Hi there. It's Miss Tiffany from the Butler Area Public Library, and I am here with another book talk. This book that we're talking about today is the June selection for the Adult Ideal Book Club. IDEAL, IDEAL, stands for Inclusivity, Diversity, Equity, and Accessibility in Libraries. You can find more information about the Ideal Book Club by going to the library's webpage, butlerlibrary.info, or by registering in Beanstack, which you can find by visiting butlerlibrary.beanstack.org. June is LGBTQ Pride Month, and the selection for the June Ideal Book Club is Bodies and Barriers Queer Activists on Health, and it's edited by Adrian Shankar. Let's read the summary. LGBT people pervasively experience health disparities. Yet many are still grappling to understand the healthcare challenges, leaving LGBT people to experience worsened health outcomes. Bodies and Barriers informs healthcare professionals, students in health professions, policymakers, and fellow activists about these challenges, providing insights and a roadmap for action that could improve queer health. Through artfully articulated, data informed essays by 26 well known and emerging queer activists, Bodies and Barriers illuminates the ubiquitous health challenges LGBT people experience and challenges conventional wisdom about healthcare delivery. It probes deeply into the roots of these disparities and empowers activists with crucial information to fight for health equity through clinical, behavioral, and policy changes. The activist contributors in Bodies and Barriers look for tangible improvements, drawing lessons from the history of HIV and AIDS in America and from struggles against healthcare bias and discrimination. So, this book is a series of essays written about different aspects of health and its associated challenges for LGBTQ plus people across all stages of life. Specifically, the book talks about health disparities. According to the Centers for Disease Control, health disparities are preventable differences in the burden of disease, injury, violence, or opportunities to achieve optimal health that are experienced by socially disadvantaged populations. Populations can be defined by factors such as race or ethnicity, gender, education or income, disability, geographic location, such as rural versus urban, or sexual orientation. Health disparities are inequitable and are directly related to the historical and current unequal distribution of social, political, economic, and environmental resources. So, what this book does is it breaks down each stage of life from early adolescence all the way up until the elder stage and talks about what the health disparities are that LGBTQ plus people are apt to experience in all of those stages of life. These include mental health issues as well as physical health issues and things like general safety in the world. The part of the book that stood out the most to me is the section on elder care. It focused a lot on how the way the system is structured in the United States, elder care often falls on the responsibility of that person's family, often their spouse or their children. And in general, LGBTQ people are less likely to have those family connections. For a long time, LGBTQ people could not get legally married. Often they were not able to adopt children, and often they were rejected by their biological family. So they don't have that support system as an elder built in to help care for them. And sometimes they don't feel safe going into places like nursing homes or other care facilities because they feel that they won't receive the same kind of care when they disclose their sexual orientation. It was definitely very eye opening. That's an aspect of LGBTQ health and care I had never even considered before. I was really impressed with this book. I thought that the essays were really well written, definitely very factually driven, and I was especially proud to see a lot of Pennsylvanians representing our state in the essays. Several of the essays were written by people that either lived or worked as activists in the state of Pennsylvania, including a foreword that was written by Dr. Rachel Levine, our former Pennsylvania Secretary of Health. She is now the current Assistant Secretary of Health in the Federal Department of Health and Human Resources. If you're interested in reading Bodies and Barriers, you can find it on Hoopla. If you have already read Bodies and Barriers and would like to read more books like it, I highly recommend The Remedy, Queer and Trans Voices on Health and Healthcare, edited by Zena Sharman. Exile and Pride, Disability, Queerness, and Liberation by Eli Clare. Head Case, LGBTQ Writers and Artists on Mental Health and Wellness, edited by Stephanie Schroeder. And How to Survive a Plague, the story of how activists and science tamed AIDS by David France. Some of these books are available either on Hoopla or through a Butler County Federated Library System library, but others are not. However, they would be available for request as an interlibrary loan item as part of the Pennsylvania Power Library that every patron has access to. I really hope that you do consider reading Bodies and Barriers if you haven't already, and if you have, please consider joining us for the Ideal Book Club. Again, you can register for that inside of Beanstack. Thank you so much for watching. Happy reading and happy Pride.